What is up, everyone? I am Charlie Shrem, and you are listening to Untold Stories, where twice a week we dive deep with crypto's most influential leaders to find out how this movement truly came to be. This show is powered by Blockworks Group, a media company with over 20 podcasts in their network. Check them out at blockworksgroup.io. With that, today's amazing guest is Chrissa McFarlane, who is the founder and CEO of Patientory Incorporated. So cool, a blockchain-powered application designed to secure and manage your health data, information in real time. Now, you ready for this? You know what I learned today? All that medical data that everyone was saying, we need to decentralize your medical data this, your medical data that. We don't actually own this data. You don't own any of your medical data. It's so crazy. You call your doctor, you say, give me a copy of you don't own that. Anyways, you'll find out more on the show. I'm Charlie Shrem. Today, I'm with Chrissa McFarlane. Thanks for coming on the show today.
Thanks, Charlie.
Did I pronounce your name right?
Yes, you did. Good job on the first try.
Everyone is always asking me, why do you ask how to pronounce my name? And English isn't my first language. So I struggle with a lot of people's names and they're, regular English names or whatever. So I'm happy that I'm figuring it out.
Really? What's your first language?
So I grew up with my parents yelling at me in Hebrew and my grandparents yelling at me in Arabic. And then I grew into I grew up here, so I learned Brooklyn English. So my English is literally like, I don't know how to say like a light bulb. Like I say like, turn off the light or close the light, I'll say, instead of turn off the light. Or it doesn't matter. But thanks for joining me today. Sure. And, you know a lot about health and I really want to get into this because I don't know if you saw my tweet like 10 minutes ago, and I wrote in my tweet, I said, so many blockchain health companies have tried to do what you're trying to do. So many companies have promised to be able to take our data and information. If you ask someone, like, you take your data and your information and your privacy and you say, what data matters the most to you? What are they going to say? What's their response?
They'll probably say their financial data, no?
Yeah, their financial, and I was going to say also their health data. So with their health data, we don't know where it is. We don't know who has it or who has access to it. I mean, how did you get into this, and what are you doing to change that?
Yeah, no, it's definitely a I would say I call it my lifelong work, right? So I've been in healthcare since, forever. So I grew up in the Bronx, started out doing microbiology research at Albert Einstein. So we'll get into which borough is better after.
Can I tell you a funny story?
Yeah.
Before you get into everything, and my listeners are going to be like, stop interrupting everyone all the time. Bugs Bunny was actually I heard it yesterday. Yesterday was Bugs Bunny's anniversary, his birthday. The accent of Bugs Bunny was created to be 50% Brooklyn, 50% Bronx, as to not offend. The voice of Bugs Bunny said that. He catered.
Really?
Yeah, really? How cool is that?
After that. Yeah. Interesting.
Okay, so tell us how the whole journey got started into health, because it's not something you just stumble into. You have to have a passion for it, right?
No, you don't. And, people joke that people in healthcare, especially health IT, are like crazy because they spend years and years, trying to prove out something. But after it's proven, it definitely has great, effects and returns on society. But eventually, I started out doing microbiome research, which didn't like the idea of being stuck in a lab.
Who does?
Day to day.
Some people do. Some doctors want to be in labs and not see patients.
Yeah. Some people want to be in a lab and not interact as much with people, but kind of went into the other journey. So did just for the USDA, went into healthcare administration, which eventually got me into healthcare consultant. So I did a lot of the at least mid-tier clinic electronic medical records implementation. So that was an initiative that came out of the Obama administration that required hospitals, clinics to start to digitize data. So if you remember back in the day, you'd go to your hospital and they had your files in a manila folder that was probably color coded. But with the digitization of health information, that created these large EMR companies, which essentially became siloed walled gardens for people's health information.
Okay.
Which creates this challenge today in what we call and relate to healthcare interoperability and being able to securely share information. And it's sad to date that, me, you, like, we don't own our health information. You might log into a patient portal, but you can't actually take that information and go anywhere with it, right?
What do you mean you don't own it?
So it is property of the healthcare. So you sign a waiver, you sign a HIPAA consent form, which becomes property of the hospital, and eventually the EMR systems, the EMR companies that are contracted by the hospital to store that information.
So you're telling me that if I write this down, I take this notepad and I write Charlie Shrem, blood type AB negative or whatever my blood type, I don't know. And that's medical data right now. I can fold it up. It's my medical data. It's private. I don't want anyone to know my blood type. I just announced it on my podcast. But is that the only medical data I own? Because all the, my doctor's office, the hospital, every time you step in there, you sign that waiver. So really, the conversation needs to be changed. The conversation up until now, and this is a breakthrough here, the conversation, and if you ask any American or any global citizen, but for the sake of this conversation, we'll say any American, they think they own their data. And in fact, blockchain health companies, I've invested in a few, have said yeah, we're taking control of your health data again. We're giving you control of it, but it's not my data. I don't own that data. So what am I decentralizing?
Air. No.
Yeah, no. So let's take a step back here, and don't get into what you're doing yet. I want to get people excited. I want to ask you about the USDA and digitizing data. I know they were separate things, but with digitizing data, around what time period did that start happening? And was there pushback on that? Was there pushback for privacy reasons or for any type of reasons of people saying, we don't want to put, our health data on the internet?
Yeah, no, I mean, EMRs, it's been around, I would say, especially in the early 2000s, going into the late 90s. It really didn't start to take precedence until that became one of the main policies out of, HHS, our federal health government, where if a hospital didn't, contract with the EMR, they would get basically penalized with a fine, right? So that was the incentivization mechanism to actually have this heavy lift to start to digitize that information.
And once that was digitized, why wasn't a centralized, I hate to say it, but in this situation, maybe a centralized government database would have been a better way to do this to protect ourselves? Because I almost wonder, who do we trust more as custodians of our health data? Is it the government or do we trust private companies? And you can ask the same question with financial data too. Who do you trust more? You could take a step further and say, who do you trust to issue currencies like Facebook Libra or governments themselves? I mean, it's a very higher end question, but I think the answer with health is different than the answer with financial data. Do you talk to people? What are their thoughts on that?
Yeah, I mean, I think the goal there was also to, we live in a capitalist country, to create, that open exchange and economy. So essentially you had companies form out of that because they were actually getting funded by the government to actually go and sell EMR systems to these hospitals. So it kind of took that strain off of the government to have these competing organizations, which eventually, we probably started out with almost over 1,000 electronic medical record companies. And today we have about probably only 4 major companies that really result for about 80% of the market.
And so how did this lead into your next, what did you do next essentially after that?
So I actually went after that consultant. I actually went to work for a telemedicine company out of New York City, out of Soho. So, the next push, next trend in healthcare was, oh, yay, we're going to be all, virtually talking to our doctors and having virtual doctor office visits, which telemedicine, back in 2010, 2012, really didn't take off because of just the barrier issues, into interoperability. Then we have the emergence of HIPAA, which is a regulation and privacy law.
When did HIPAA launch? When did it become a thing, the act?
HIPAA has always been a thing. Like, it was created to basically protect the privacy and security of individuals' health information. It was actually passed in 1996. So this was way before Obama. This was like during Bill Clinton. Yeah.
I think HIPAA is one of the most important pieces of legislation in our country right now. How many times do people reference HIPAA on a monthly or yearly? You visit your doctor a few times a year. How many times does HIPAA come up a conversation, right? How many times do you reference other acts or other government legislation on a monthly or quarterly basis? So it's so important to protect our medical data. And so you moved on to telemedicine. Was there a risk of now, like, how if someone's talking to you, if you're a doctor, I'm talking to you right now, we're on the was there a risk when it comes to how the encryption or how the data or where it would be stored or how to verify patients? Like, and telemedicine never really, like, it took off, but it never really took off until the COVID, until coronavirus, really. Yeah.
Which is fortunate, because
what do you think about that?
Been around for technology in healthcare, like, it's there. Looking at telemedicine, it's been around for over a decade. And, with CVS, they saw like a 300% increase in their telemedicine platform. But it wasn't until this pandemic happened, until they started to really actively push for that. And that happened because the US laxed laws, around data access and security for that to happen.
Yeah. How is it different, though, than other countries? I feel like we have it better.
You think so? Have it better in terms of health, telemedicine or healthcare?
So I was referencing how the data, like, in terms of trust, how the data is stored and controlled. But when it comes to telemedicine and healthcare in general, you actually tell me that I'm wrong, because you know better than I do. I only look at Canada, UK, and then the countries where I have friends that live. Most people I know don't have to pay for their own health care. It's like there's like a private health care, and then there's like a supplementary system. So a lot of people I know have this like supplementary system. And this is actually a great segue. I wrote it down to segue into this. And so thank you for that opportunity. Not the problem, but the question that I have for you is that capitalism and the way our economy is built, a unified social health care system not that it couldn't work, but I need to understand how doctors and healthcare professionals and pharmaceutical companies will stay competitive and also want to work as hard and to maintain that talent, because the way our healthcare system, the way that some of these other countries, their healthcare systems are built, like the UK and Canada, it disincentivizes doctors from even staying in those countries. So at the same time, like, I think if someone says like Charlie's America broken, I'm going to say no, but there's a lot of things. But healthcare is something that we could tackle now, and healthcare is something that I feel like can provide a lot of. I actually didn't let you like answer the question. So what do you think about everything I just said first?
I think you had a lot of questions in there.
I did. I do that a lot.
I'm going to try to sum it up or just start with the first half of the question.
Healthcare in America. That's like, what are your thoughts on healthcare in America?
Yeah, healthcare in America, basically, and how it relates to our peer countries, developed countries who have healthcare as a social good. Their citizens don't necessarily pay unless they want like private healthcare, right? But healthcare in America is definitely, it's a market, right? It's a market ecosystem. So I would say, liken it to, the emergence of the digitization of data. We're really not going to see an incentive or really quick push for organizations and EMR companies to want to share that data, because there is no incentives for them to do that, right? And that's the biggest trouble that we have right now in health IT with interoperability, and why this has been one of the main challenges in healthcare for the past 15 or so years. Our company, we actually just released a peer-reviewed journal through, we're part of the Oregon Enterprise Blockchain Venture Studio that was launched last summer.
I love
so
Atlanta.
This article, no, it's actually out of Portland.
I still love Atlanta.
Yeah.
not Portland very much. I'm just joking.
Not Portland. But that was incentivizing change, right? Using blockchain technology to access data for social and economic determinants of health. And what we basically hypothesize and premise is that, we're really not going to see a push for, data ownership or even access from the consumer, the patient, until stakeholders such as insurance companies, hospitals are incentivized to actually want to be able to share that information. And that's where blockchain comes in providing that incentivization layer mechanism. So essentially it becomes a health information exchange market where hospitals can actually see, value in doing that and being reimbursed for that. So I think, healthcare in the US is complex. I think we have one of the most complex healthcare systems out there because of the lack of, government control over that, whereas they provide more of the framework and the policies for our healthcare to operate. But, it can also be a lucrative space. So until, everyone, really meets in the middle, we can start to see, those benefits really play out to the patients.
Okay, come on. This is so cool. This is the new Bitpay card that I have in my hand, and I'm so excited to be finally having the new one that just came out. Now, guys, I've been using the Bitpay card since 2016. Yeah, you heard that right. Way before I started Untold Stories, way before Bitpay became a sponsor of mine. I've been using this card, and it literally became a way for me to have a bank account for many, many years, as a lot of people in crypto need better banking. The Bitpay card is chock full of the coolest features. It's got contactless pay, better rates and limits, no fees to convert from Bitcoin right onto the card, added in chip security. I mean, it's sexy, it looks good, unlike other cards. It's so easy to get. Just download the Bitpay app on your phone, click the card icon, and you can do it right there. If you use the promo code CharlieJune20, your card is free. Remember, CharlieJune20. It's in the show notes. You can get a free card. So literally, just from listening to my show today, and make sure you actually listen, you could get a free card just by entering that code. So download the Bitpay app, get the coolest card on the market, the best card on the market. I've been using it for over 4 years now. I know there's so many cards out there, but the Bitpay brand is the oldest and longest running Bitcoin company in the world. I mean, that's who issues this card. This is the card you want to have. Remember, CharlieJune20. Download the Bitpay app on iOS or Android to sign up for the new card. You're going to freaking love it. Do states, so you look at like the Florida Department of Health and the Georgia Department of Health. Are states' healthcare institutions strong enough to almost say, for the federal government to say, okay, we'll do state-run healthcare. So instead of doing like federal healthcare system, it's run and managed by the states and have marketplace. I've heard this idea floated around, and then obviously your insurance would work around the country, because the idea was that, it works in most of the world. It works, social healthcare, standardized healthcare, single payer healthcare system. It works, but it works in places where the countries are a lot smaller. And so you have less people and you have the ability to manage that. We live in a very big country, a lot of people, and that's always been one of the issues with these federal systems, is that we're all different here. So how do you have one size fits all legislation?
Yeah, and I think we already do that with the states, right? And this is one of the issues with the CDC. Like, they have a hard time getting access to data because they can't just go to Florida and say, we need all of the data from individuals that had
Oh,
COVID, right?
really?
Yeah, no, that doesn't exist. Which is, you're thinking that it's CDC, they're a federal entity, they can get information from anywhere. And that's also one of the issues with health information exchanges, HIEs, which, was started in the early, late 90s, early 2000s, which basically confined data exchange to states, but they can't actually exchange data, cross states. So, I mean, this is the challenges that already exist. And I think because, again, having that concentration of power, within states is really hard from a national country
Where
for
do you
to come together.
you work in an industry where it's very much about the individual, the person, but also the collective. Has it affected your political leanings? Because at the end of the day, you are in crypto and blockchain that has its roots in libertarianism, anarcho-capitalism, but with healthcare, where I personally fall on the spectrum is less that leaning and more, I hate to say it, more of I do believe there should be institutions here in our states or in our cities that, and potentially having a statewide or whatever single payer healthcare system. And I surprise myself when I admit that. But have you found yourself thinking about your political and social views on that?
I mean, yes and no. It's like, when you're in healthcare, it's like you have to do the moral good for the benefit of everyone, right? And slowly you kind of see the push to our system for a more single payer, even with the acquisitions that are happening now. So we're starting to see less and less, clinics, individual clinics that are being bought up by major health systems, insurance carriers that are buying up smaller carriers. So I think, that need is there. Absolutely.
Has the national conversation changed around single payer healthcare? I remember, if we go back to January and I asked you, and there's no COVID, do you think in the next 6 months, President Trump would try to rescind more of Affordable Care Act? What would you tell me? Yes. Would you tell me yes? Okay, exactly. Yeah. Now, though, it's not part of the conversation anymore. So has the national feeling changed?
It's not as much. Why? Because of COVID. We're seeing the data coming out of, especially underserved communities.
That's the problem.
They're not getting any access or any treatment. When COVID first hit, most of that went into, communities that were well funded or had that infrastructure in place. While, the other part of the country, it was hard to get anything. So we're seeing a lot more of those stories come up as we look at the inequalities and the inequities that exist in the healthcare space.
Inequalities and inequities exist, unfortunately, in so many different institutions in our country. And I feel like with the protests and the movements in the past, and the BLM movement and all the different, ideas in the past few months, I feel like it's not, why hasn't it, or maybe I'm wrong, focused on other areas of inequality that could potentially change the socioeconomic status of people? Change the healthcare system, make it an equal system. People can then sleep at night knowing that they have healthcare, and therefore they'll be a lot more secure in going out and finding work or caring for their family.
You would think, right? And it seems like a simple, I would say, answer to a hard problem.
I know. And so we look at, what historians do, because I study a lot of history, but what historians like to do is they like to compare old events with new events. And so what they will say, hopefully in 20 years from now, that out of this coronavirus pandemic that we've been through, we've learned a lot of things. And I hope that they say we've learned. And I hope that one of the things that has changed because of this is, it's not a big ask, but I hope one of the things that changes is equality when it comes to healthcare, because I do believe that we need that. It's very expensive. Healthcare is expensive in this. People don't realize it's like a couple, a normal middle, like a middle class couple, two people, doesn't matter like socioeconomic status. But if you're reasonably healthy and lower middle age, it's costing you over $1,000 for healthcare a month.
Yeah.
And you could rent a Maserati. You could lease a Maserati for that price.
Exactly. Right.
People don't realize that. Can you repeat that again? It's crazy.
You said rent a Maserati. I mean, that's the healthcare in this country, right?
What would you rather, have healthcare or a Maserati? I don't know. I would almost rather the Maserati, to be honest.
Yeah, I mean, you think that if you needed to go to the doctor, might as well. It's probably cheaper paying out of pocket, right?
Yeah.
You look at the cost benefit of it.
Are you involved in the crypto community in ATL?
We have actually our blockchain community is the Atlanta blockchain meetup is the largest community that we have. I actually got them, to meet in our offices. That's as far as
cool.
I met my involvement there.
I met that host of that meetup because we ate bison steak in Atlanta together back in February, right before coronavirus.
Oh.
Yeah. So this show is sponsored by, I have two sponsors, Bitpay and Coin Gaming, and Bitpay is actually based in, I know all the listeners are getting ready to like fast forward the commercial. Like, this show is sponsored. No, it's not the commercial yet.
But yeah, Bitpay was actually out of our offices as well, Atlanta Tech Village, until it moved out.
I love Avalon where they are now up in Alpharetta. It's cool up there.
Yeah, Avalon is nice. Yeah,
it's cool up there. I think Georgia has always had a huge tech community and a huge crypto community. A lot of the companies, the early companies, Jeff Garzik comes from Georgia, was based out of Atlanta too. So you have a lot of early crypto OGs still are and were based around Georgia and Atlanta and everything like that. Okay,
and Atlanta doesn't get any love from the crypto community as much as like New York or San Francisco.
Well, we were supposed to move to Georgia. Atlanta was our moving location 4 years ago. I love Atlanta, and then I'm a big fan of the food, especially. And then I found out about this place where I live now here in Florida. I came here on vacation with my mother-in-law, and it was her idea. And I was like, I love Atlanta, but I like Sarasota more. Okay, so Patientory, taking all the stuff that we've talked about and learned in the past 30 minutes. Why did you start this company, and how are you using it to change the way healthcare technology is handled in our country?
No, absolutely. No, I started the company because of my experiences, going through and building that telemedicine company and just looking at it and saying like, our whole system is not right. Right. And the technology wasn't there, and the infrastructure that we needed to have in healthcare just wasn't there. So, when we first launched the company, we were looking at different technologies to be able to really start to integrate, these electronic medical record systems. We had a lot of API companies in the marketplace already, that were trying to do the same thing, in digital health. Came across blockchain. So this was like late 2015. No enterprise industry for blockchain yet. But I was like, the research in me was like, okay, yeah, this is it. I mean, we have security, authentication. It makes sense. So went that path. Started to reach out to like early, crypto blockchain people in the community. Met up with Storage, who's also out here in Atlanta.
Oh yeah, I forgot they're out there too. That's cool.
Yeah. Who became an advisor to the company. And essentially what we conceptualized was, creating this decentralized and distributed health information exchange system that would be able to normalize, but start to aggregate data from these different disparate medical record systems, right? So that we can actually start to, in healthcare, manage big data. So a lot of the companies today, they're getting information from third-party clearinghouses. They're scrubbing claims data, which is not really the entire picture. And, in healthcare, the goal is to go back to putting the patient at the center of that care. So having the patient own that information, but also start to have that patient, have a place where all of that generated data on a day-to-day basis can be housed in a system that would give physicians even more accuracy and insights and intelligence to their patients, which makes it easier for them to diagnose, right? In telemedicine, like what we were seeing, when we had our doctors have the first consultation, with a patient over the phone, it was like, okay, who are you? Like, I don't know why you're having these symptoms. And it's like, it would be so much easier if they had all that information there at hand.
So if they had all that information there, do you think how we get diagnosed and how we get prescribed medication, would that change? Would the incentives for doctors change?
Absolutely. And I think, and you said incentives, like now our system is going from a fee-based, reimbursement model. So CMS, how they reimburse healthcare practitioners is now focusing on more value-based. So is your patient population getting healthier, right? And on the basis of those metrics and those quality metrics, we're going to give you X amount of dollars. And I see that push because, in the past 5 years, more than 40% of our country has one or more chronic illnesses, and we're ranked pretty low on, the healthy country index.
Why? Why are we ranked so low on the healthy country index?
Because healthcare is hard for people to get access to healthcare. So if you look at countries where, healthcare is socialized, their patient population is going to be healthier. But that's one of the unfortunate effects and side effects of our healthcare system.
Do Europeans or Canadians, I'm just using them as an example, do they visit their doctors more? Do they have different types of relationships with their doctors versus like how we have, our relationship with our doctors here in the US?
Yeah, I would say it's definitely going to it's going to, vary by household, right? And how much income they have and how much access they have to healthcare. But essentially the average, I would say, European or Canadian person, has a healthier relationship with their providers or their physicians, because that's something they don't have to worry about paying a copay or cost incurring.
True.
They have a sneeze. So
they can make it.
Here in the US, it's like, oh my gosh, I have a fever, but I don't want to go to the emergency room because I'm going to be billed $150 copay. So,
we talked about all the good things about single payer system. The negatives that you hear is that the quality of healthcare goes down with that. Although the access, goes up, the quality goes down. But then a response that I heard and that I kind of understand, but I don't like, is that in fact, it'll further push for inequality, because you're going to have, doctors and hospitals choose to only take patients that have that like supplementary insurance, or it's just going to shift the narrative or change. At the end of the day, do we have enough beds, doctors, nurses, hospitals for the amount of people to have those type of relationships with our doctors, hospitals, et cetera, et cetera? I guess that my fear is that it'll like push for further inequality, because you'll have like someone who can't afford health insurance have the single payer healthcare system that provides for like, doctor's visits, things like that. And then the supplementary gives you like, I don't know, what are some things that the supplementary specialized doctors or, faster, like cut the line type of thing?
Mm-hmm, mm-hmm, mm-hmm. Yeah, I mean, we already have a shortage of nurses and healthcare practitioners in the country, right? And I think that's where technology comes in. That's where the utilization of telemedicine, or even stratifying that, can help to solve, the issue of going to a single payer system and then having an influx of healthcare users, to where we can start to push these types of technologies to help manage that burden.
What's the future? I mean, if we're sitting here talking a year from now, what type of small step success would you like to see? We're a year from now, we're in a post-COVID world. Who knows what the world's going to look like, but we're in a post-COVID world. We have a treatment, vaccine, whatever. But now we can get back to normalcy a little bit. You think any progress can now part of the national conversation, regardless in whose political office? Do you think now something can change?
Yeah, I mean, we actually had a big change in March. So HIMSS, which is the Global Health IT Conference, but organization, membership base that's based here in the US. I sit on the interoperability chair. They're one of the key, pushers of the 21st Century Cures Act, which went into effect this past March.
What was that?
So this basically, is a precedent for, allowing healthcare institutions to provide third-party intermediary access to vendors like Patientory or like an Apple or like a Google.
Oh.
So individuals can start to gain access to their data. And this has been lobbied, for years by these electronic medical record companies. I don't know if you saw something by one of the CEOs. They were like, people don't need to have their health data because they don't understand it. So
come on.
Have it. So I thought that was really disturbing. But so that happened in March.
That's not true. That's not true. I'll tell you why that's not true. Because I was having dinner with my mother-in-law the other night and my wife, and we were joking around that she's a personal trainer, my mother-in-law, and she had a client say, "Hey, can you read my MRI?" And my mother-in-law's like, I can't read an MRI. I'm a personal trainer. So there's this fear, right? Meanwhile, so her client had to fight the doctor for the full copy of everything for her own data. And then it wasn't that big of a deal. When she read the MRI, she didn't mean look at the x-ray. She meant read the doctor's notes and things like that, which is actually written out in plain English. And because of that, my mother-in-law was able to properly make sure she doesn't do certain workouts that could affect her client.
Look at that.
That's a perfect usage of why we need our medical data. It's the exact reason. I could pull it up on my phone. Patientory.
Exactly.
Chrissa, thank you so much for coming on the show today. I cannot think of a better way to just end it off. Everyone hopefully will have a better understanding of why this is such an important conversation to have.
Absolutely. Thanks again, Charlie.
Thank you so much.